Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
While tea leaves have long been celebrated for their refreshing taste and potential health benefits, it's essential to acknowledge that they also come with certain disadvantages that warrant consideration. From caffeine content to potential interactions with medications, understanding the drawbacks of tea leaves allows individuals to make informed choices about their consumption and tailor their tea drinking habits to their unique needs and preferences. Caffeine content. Tea leaves contain caffeine, a natural stimulant that can have both positive and negative effects on health. While moderate caffeine consumption is generally considered safe for most individuals and may confer benefits such as improved alertness and cognitive function, excessive intake of caffeinated tea leaves can lead to adverse effects. For sensitive individuals or those with certain medical conditions, such as anxiety disorders or heart conditions, high caffeine consumption from tea leaves may exacerbate symptoms such as insomnia, restlessness, palpitations, and increased blood pressure. Moreover, habitual consumption of caffeinated beverages like tea leaves can lead to tolerance and dependence, requiring larger doses to achieve the desired effects and potentially leading to withdrawal symptoms upon cessation. It's essential for individuals to be mindful of their caffeine intake from tea leaves and consider moderating consumption or opting for caffeine-free alternatives if they experience negative effects. Staining teeth. Tea leaves contain tannins, polyphenolic compounds that contribute to the beverage's flavor, color, and astringency. While tannins are largely responsible for the characteristic taste and mouthfeel of tea leaves, they also have the potential to stain tooth enamel over time, particularly when consumed regularly and in large quantities. Dark teas like black tea, which undergo extensive oxidation during processing, tend to have higher tannin levels and may pose a greater risk of staining teeth compared to lighter teas like green or white tea. Tooth staining from tea leaves typically manifests as yellow or brown discoloration on the enamel surface, detracting from the appearance of the smile and necessitating additional dental care to address. Individuals concerned about tooth staining from tea leaves can take preventive measures such as practicing good oral hygiene, rinsing the mouth with water after consuming tea, and scheduling regular dental cleanings to remove surface stains. Potential for dehydration. While tea leaves contribute to overall fluid intake and hydration, they also possess diuretic properties due to their caffeine content, which can increase urine production and potentially lead to dehydration if consumed in excess or without adequate water intake. Although moderate consumption of caffeinated tea leaves is unlikely to cause significant dehydration in healthy individuals, excessive intake or prolonged consumption of large quantities of caffeinated beverages may exacerbate fluid loss and contribute to dehydration, especially in hot climates or during strenuous physical activity. Symptoms of dehydration include thirst, dry mouth, dark urine, fatigue, dizziness, and confusion, and severe dehydration can lead to serious health complications if left untreated. To maintain proper hydration levels while enjoying tea leaves, individuals should strive to balance their tea consumption with sufficient water intake throughout the day and be mindful of signs of dehydration, particularly during periods of increased fluid loss. Interference with iron absorption. Tea leaves contain compounds called tannins, which can bind to dietary iron and inhibit its absorption in the gastrointestinal tract, particularly non-heme iron from plant-based foods. While this effect is relatively modest and unlikely to cause iron deficiency in individuals with adequate iron stores and a balanced diet, it may pose a risk of iron deficiency anemia for vulnerable populations, such as pregnant women, young children, vegetarians, and individuals with pre-existing iron deficiency or malabsorption disorders. Chronic consumption of large quantities of tea leaves, especially with meals high in iron-rich foods like legumes, leafy greens, and fortified cereals, may exacerbate iron absorption inhibition and increase the risk of iron deficiency over time. To mitigate this risk, individuals at risk of iron deficiency should consider consuming tea leaves between meals rather than with iron-rich foods, optimizing dietary sources of iron, and consulting with a healthcare provider for personalized guidance on iron supplementation if needed. Digestive issues. Some individuals may experience gastrointestinal discomfort, bloating, acid reflux, or other digestive issues after consuming tea leaves, particularly on an empty stomach or in large quantities. This may be attributed to various factors, including the caffeine content, tannins, and acidity of tea leaves, which can irritate the gastrointestinal lining and increase stomach acidity, leading to symptoms such as heartburn, nausea, abdominal pain, and diarrhea. Additionally, certain compounds in tea leaves, such as polyphenols and catechins, may exert laxative effects and stimulate bowel movements, particularly in sensitive individuals or those with irritable bowel syndrome, IBS, or other digestive disorders. While these effects are typically mild and transient, individuals experiencing persistent or severe digestive issues from tea leaves should consider reducing their consumption, avoiding tea on an empty stomach, and opting for gentler varieties like herbal teas or low-acid teas to minimize discomfort. Potential for allergies. While rare, some individuals may be allergic to certain components of tea leaves, such as pollen residues, plant proteins, or additives used in processing and flavoring. Allergic reactions to tea leaves can manifest as skin rashes, itching, swelling, hives, nasal congestion, sneezing, wheezing, or difficulty breathing, depending on the individual's sensitivity and the specific allergen involved. In addition to plant-based allergens, flavored teas and blends may contain additional ingredients such as nuts, fruits, spices, or artificial flavorings that can trigger allergic reactions in susceptible individuals. Individuals with known allergies to tea or related plants, such as Camellia sinensis or other members of the Theaceae family, should exercise caution when consuming tea leaves and carefully read ingredient labels to avoid potential allergens. In cases of severe allergic reactions, such as anaphylaxis, prompt medical attention is essential, and individuals may need to avoid tea leaves altogether to prevent further allergic episodes. Risk of contaminants. Tea leaves, like other agricultural products, have the potential to accumulate contaminants such as heavy metals, pesticides, herbicides, fungicides, and environmental pollutants from soil, water, air, and processing practices. While regulatory standards and quality control measures are in place to minimize the risk of contamination in commercially available tea leaves, certain factors such as agricultural practices, geographic location, soil composition, and manufacturing processes can influence the presence of contaminants in tea products. Chronic exposure to contaminants in tea leaves may pose health risks, including toxicity, carcinogenicity, neurotoxicity, and reproductive and developmental effects, particularly in vulnerable populations such as children, pregnant women, and individuals with compromised immune systems. To minimize exposure to contaminants in tea leaves, consumers can opt for organic or sustainably sourced teas, brew tea with filtered water, and adhere to recommended brewing guidelines to reduce potential health risks. Additives and flavorings. Flavored teas and blends often contain additional ingredients such as natural or artificial flavorings, sweeteners, spices, herbs, fruits, flowers, or botanical extracts to enhance taste, aroma, and visual appeal. While these additives are generally recognized as safe for consumption and may contribute to the sensory experience of tea leaves, they may not align with everyone's dietary preferences, sensitivities, or health goals. Some individuals may be sensitive or allergic to certain flavorings or additives, experience adverse reactions to artificial sweeteners or preservatives, or prefer to avoid certain ingredients due to ethical, cultural, or personal reasons. Additionally, flavored teas may contain added sugars or calories, potentially contributing to excess calorie intake, weight gain, or adverse metabolic effects if consumed in large quantities. Individuals concerned about additives in tea leaves can opt for unflavored or naturally flavored teas, read ingredient labels carefully, and choose products that align with their dietary preferences and nutritional needs. Risk of dental erosion. Tea leaves, particularly fruit-infused or flavored teas, may contain acids that can erode tooth enamel over time, especially when consumed frequently or in large amounts. Acidic beverages like tea leaves can soften and wear away the protective enamel layer of the teeth, leading to dental erosion, tooth sensitivity, and an increased risk of cavities and tooth decay. While the acidity of tea leaves varies depending on factors such as tea type, brewing method, and additives, individuals with pre-existing dental issues, enamel erosion, or sensitive teeth may be more susceptible to damage from acidic beverages. To minimize the risk of dental erosion from tea leaves, individuals can practice good oral hygiene, limit consumption of acidic beverages, use a straw to minimize contact with teeth, and rinse the mouth with water after drinking tea to neutralize acidity and promote saliva production. Potential for medication interactions. Tea leaves contain bioactive compounds such as polyphenols, catechins, caffeine, and theanine, which may interact with certain medications, affecting their absorption, metabolism, or efficacy. Tea drug interactions can occur when tea leaves interfere with drug absorption in the gastrointestinal tract, alter drug metabolism in the liver, or compete for binding sites on target receptors, leading to reduced therapeutic effects or increased risk of adverse reactions. Common medications that may interact with tea leaves include anticoagulants, antihypertensives, antidepressants, antibiotics, thyroid medications, and stimulants. Individuals taking prescription medications should consult their healthcare provider or pharmacist before consuming large quantities of tea leaves or herbal infusions, particularly if they have pre-existing medical conditions or are on multiple medications, to avoid potential interactions or adverse effects. Healthcare professionals can provide personalized guidance on medication management and tea consumption, recommend alternative therapies, or adjust medication doses as needed to optimize treatment outcomes and ensure patient safety. In conclusion, while tea leaves offer numerous advantages, it's crucial to approach their consumption mindfully and be aware of potential disadvantages. By staying informed about the risks associated with tea leaves and taking proactive measures to mitigate them, individuals can continue to enjoy the pleasures of tea while safeguarding their health and well-being. Whether savoring a steaming cup of green tea or indulging in a fruity herbal blend, let's raise our mugs to the joys and complexities of tea leaves, embracing a balanced approach to tea appreciation.